Thrilled to welcome a special guest to today's MediMobile Fireside Chat, Paul Valenzuela. MediMobile's CEO joins us with a wealth of experience in charge capture and autonomous medical coding. We can't wait to dive into this week's chat. Thank you for joining us, Paul. It's a real pleasure to have you with us today.
Thanks, Rudy. I'm glad to be here.
Well, let's jump right in. So let's talk a little bit about big picture. So from a big picture standpoint, doctors are busier than ever, but somehow they're earning less. From your perspective, what's really driving that disconnect?
There are a lot of changes happening today in healthcare. Providers are spending more and more time on their administrative tasks just to get their job done on a daily basis. There are things like regulatory pressures that are putting a lot of pressure moving toward a value-based model. The reimbursement rates continue to decline. Physicians are being asked to justify their work in great detail. What that means is more documentation, which again takes more time, paying closer attention to their coding, and a lot more prior authorizations are affecting a lot of their time getting things done.
Yes, absolutely. There's no doubt about that. But let's talk a little bit about where the money slips away. When we talk about lost revenue in healthcare, what does that actually look like for a provider or a practice on a day-to-day basis?
So all these activities are cutting into their billable hours. With some of these increases come higher expenses. So the costs for staff or added staff, additional duties, all of those things affect the bottom line. These pressures are directly impacting revenue. The delayed reimbursement also affects cash flow, and ultimately they create missed revenue opportunities.
Well, that's most unfortunate. And then there's also the human toll. So behind the numbers are real people. How do you see this financial pressure impacting doctors, coders, and even patients?
It's a very good point. These added pressures are causing many of these providers to choose to work fewer hours. Some are moving into part-time roles, causing shortages of providers in the healthcare space. Burnout is also a reality in this space for providers, for coders, and other staff members. So a lot of the extra hours that are being worked are causing that demand to be more or less the new norm. On top of that, revenue challenges are pushing providers to look for other avenues of providing healthcare. So a lot of them are going into the telehealth space, consulting space. Some of them are actually working for multiple practices. So all of those added pressures of revenue that are affecting them are causing them to do different things that are now more common paths in today's environment.
Well, that's most unfortunate. So, Paul, give us some insight into how MediMobile helps. If I'm a provider listening to this, what difference would MediMobile actually make in my workday? Can you walk us through what that change would be right away?
Yeah, so assisting providers and coders with their day-to-day work, that's what MediMobile can do. By letting providers know up front if their documentation is accurate, so we reduce some of the time that it takes for them to continue to do these different things. So we provide systematic approaches to tell them if their documentation supports their coding. We can save time and ensure more accurate results in that way. We also streamline documentation for coders. So instead of them manually having to go retrieve medical records, that takes up a lot of time that could be used for producing a lot more quality coding. So focused on the quality tasks that help the bottom line are important. So we're trying to take those tasks away by streamlining many of the workflows. When the
No.
coding improves, it directly impacts the bottom line. So those are the things up front that we're seeing are helping these practices and the bottom line.
Excellent. So, streamlining is a key component of that. So, we also know that what really matters is practices are struggling to stay afloat. How quickly do they start seeing a real financial impact once they bring MediMobile on board?
Good point. We've seen this firsthand. For example, we brought on a practice that had a strong handle on their revenue. They relied heavily on their forecasting, so they really understood their business. Within 30 days of them coming onto MediMobile, our document processing and reconciliation uncovered some huge benefits to them. About 20% of their charges had not been billed, something that they hadn't known in the past, but they saw an immediate change to their revenue from 1 month to the very next after onboarding our system. They were impressed how quickly the system identified the gap, and they were even more impressed how quickly that helped them recover that revenue. So that's real impact that affects these practices in really little to no time. And that's just one element of streamlining that.
Wow, that's phenomenal. And such a quick turnaround, too, that they started seeing results.
Absolutely.
So let's take a little look ahead here. Let's take a look ahead. Some practices are pivoting to concierge care or selling to private equity. What's your take on those paths and where does MediMobile come into play?
So a lot of things are changing within the healthcare space, as I mentioned early on.
Mhm.
You do see consolidation of practices within some of the smaller groups going to either larger groups being consolidated into larger practices. MediMobile actually benefits from that because now we're actually helping those larger practices see higher yields in efficiency, the gains in terms of all their coding and their workflow processes, and it helps their efficiency tremendously. So the larger the practices, the better MediMobile fits into the whole, the better MediMobile fits into those size and types of businesses. So we're ready to take on those types of changes that are happening in the business front, and
Mhm.
MediMobile will certainly help them in the same ways.
Excellent. So let me ask you a quick question here. How have you seen the healthcare RCM and charge capture landscape evolve over the last few years? And what major changes do you anticipate that are maybe coming in the near future?
So some of the things that I've seen in recent years are
Mhm.
technology advancements. So the use of AI, the use of different technologies within the healthcare space, within the RCM space. Many providers are having to use new technology that hopefully speed things up for them, but in some cases they do actually slow things down. So one of the things that we do see is that same technology is making it easier for the systems to validate the documentation. So it becomes more pressure on the provider to make sure they're coding properly and documenting properly because that technology is basically ensuring that they're accurate. And again, a lot of rework is having to be done by the providers because this technology is finding those deficiencies potentially in the documentation and again causing more work. So in a way, the technology has actually made it a little bit harder for the provider because it also helps find errors and consistency a lot
Mhm.
faster with the newer technology that's available today's past.
Okay. All right. Well, that's good insight. Thank you so much, Paul, for sharing your knowledge and perspective with us and our listeners. Your insights have truly enriched our conversation, and we appreciate you taking the time to join us here at MediMobile Fireside Chat. We hope to have you back again in the near future.
Thank you very much. It was wonderful.